Welcome everyone to the Learning Community Series, Families Serve Too, Understanding the Behavioral Health Needs of Military and Veteran Families session. This is the first session in this series, and we're so grateful that you're able to join us today. We are recording the session, so if you'd like to reference the recording after the session, I'll be able to get that emailed out to folks. I am your series moderator. I'm Angela Wright, a Senior Project Associate with SAMHSA's Service Members, Veterans, and Their Families Technical Assistance Center. And I'm so pleased to be able to share this series with you and to focus on the families during this session with our esteemed presenters. At this time, I would like to turn things over to our SAMHSA partner, Stacey Owens, to give a warm welcome. Stacey?
Thanks, Angela, and good afternoon, everyone. I'm Stacey Owens, Acting Military and Veterans Affairs Liaison for SAMHSA, and thank you for joining us for this first in the series focused on military families. We're so happy to have Jessica Strong from Blue Star Families and Larissa Owen from Children and Family Futures here to share the expertise that they've gathered in their respective roles. And I'll share from personal experience that I grew up as a military kid, and while I had an awesome childhood, I do remember some of the challenges that occurred, like moving both interstate and internationally, things like having to travel long distances for specialty healthcare appointments. And while my father was never deployed, I remember actually having kids live with us for a period of time because their parents were dual military and both deployed. And looking back with my adult eyes, from my adult perspective, I realized that our families weren't even that close, but these active duty parents had limited options and they had to trust their gut instinct that told them that my parents would care for their children and not harm them in any way. So we really appreciate you all taking the time out of your busy schedules to learn more about some of these unique challenges faced by military families. And again, we also really appreciate Dr. Strong and Dr. Owen for being here to share their insights. And I'll turn it back to you, Angela. Thanks.
Thank you so much, Stacey. Just a quick disclaimer before we get started. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of SAMHSA or HHS. So I'm going to give you a quick overview of the agenda today. We're going to do a little bit of housekeeping, and I'll go over the objectives for our learning community session. We'll have some time for introductions, and then we'll put up a quick poll. And then I'll turn things over to Dr. Jessica Strong with Blue Star Families. She's going to talk about the military family experience and the information and insights that they've gathered from the Military Family Lifestyle Survey, particularly around behavioral health needs of military families. Then we'll have some time for questions and some facilitated discussion. And so I'd like to invite you to participate in these discussions, to share your experiences. I'm going to ask that you come off of mute and talk. And so maybe get yourself prepared to do that a little bit and make this a rich and engaging discussion. We will then turn things over to Dr. Larissa Owen, and she's going to be discussing identifying and engaging military families and sharing her experiences with those issues. And we will again have time to ask her some questions, have some facilitated discussion, and then we'll do some next steps and adjourn at 3:30 Eastern Time. So while we're in this session, this is meant to be, an engaging, participatory experience. We'd like for you to be able to talk and speak and ask questions. We don't want this to be us talking at you. We want you to be able to feel free to chime in and to be able to really just share insights and have some time with the experts to ask about their experiences and their knowledge and and to have this a time of learning for all of us. So while we do that, please make sure you identify yourself when you speak. That'll help me. You can use the raise your hand feature. It's at the center top hand of your screen. And I'll be able to call on you and manage the conversation that way. Or you can type in the chat any questions that you have. While you're not speaking, please make sure to mute your computer speakers and phone lines to help minimize disruptions. And then also while we're in discussions, let's just keep each other in mind. All right, so our objectives here today. So we're hoping that you will, upon completion, be able to describe the military family experience and share insights on their behavioral health needs, illustrate the importance of identifying and engaging veteran families after they have separated from military service, and identify resources for screening and providing military culturally competent care. That is what we'll be focusing on today. All right, let's take some time to introduce ourselves. So I would like for you to, in the chat, type your name, your agency that you're with, whatever state or team that you're associated with, if you're a part of a governor's challenge team, a mayor's challenge team, or otherwise. Let us know who you are and where you're from. I'm hoping that we'll be able to get some time to discuss and get to know one another. Okay, so as you're typing in the chat, Emily is going to be pulling up a poll question for you. It is, have you or an immediate family member ever served in the armed forces? So we just want to get a sense on how many folks in the audience are part of a military family or have been part of a military family. So just want to take a few seconds to answer that poll. That'd be wonderful. All right, Emily, I think we could give them about 10 more seconds and then we'll broadcast the results. Okay. Great, look at that. We have about 89% of our participants today have served or have had an immediate family member serve in the armed forces. Wow. Well, thank you all so much for your service and for being here with us today. And I am extremely pleased and excited to turn things over to our first presenter, Dr. Jessica Strong. She is coming to us from Blue Star Families. She's the co-director of applied research there. Her work focuses on the annual Military Family Lifestyle Survey. She also develops, executes, and analyzes other research projects that supports the Blue Star Families mission. She holds a Ph.D. in social work from Rutgers University, and she is also an active duty Army spouse with 3 children, currently stationed at Fort Campbell, Kentucky, and I believe PCSing today from there, going on to another location. So thank you so much, Jessica, for being with us today, and I'd like to turn things over to you now.
Yeah, thank you very, very much for having me. I appreciate it. Yes, we are in the middle of PCS, so which makes me very grateful for not having video today because I am presenting from a very empty house. But I wanted to take the opportunity to meet with, to present with you guys because I know that the work that SAMHSA is doing is very important, and I am personally really interested in making sure that all of our healthcare, behavioral healthcare providers understand military culture. And it looks like many of you do. because you're coming from families that have some military experience. And I find that's often the case when people are interested in military family issues, is that it has touched their lives at some point, which is how I got to the Military Family Lifestyle Survey and Blue Star Families. So Blue Star Families, this presentation is going to cover a very small, select portion of the results that we have from our 2020 Military Family Lifestyle Survey. It's an annual survey that we do each year, and we have since 2009. So I'm giving you a little bit of what we've discovered, but there's a lot more in the comprehensive report, and then there's more coming, more to come. So let's go to the next slide real quick. Let me talk for a minute about what Blue Star Families is and does. So Blue Star Families was founded in 2009 by a group of military spouses who saw that there was this growing disconnect between military families and the local communities in which they live. The majority of military families, it's between 65 and 70% of respondents to our survey and in the military population as a whole, live off the installation in local civilian communities. So they noticed this sort of growing disconnect between military families and their local community neighbors and the communities in which they lived. So they wanted to strengthen that connection, to create these communities of mutual support. And so that is the focus of Blue Star Families, is creating communities of mutual support for military families and the civilian communities in which they live. Next slide, please. So we do that in several different ways. One of the ways, and my favorite way, obviously I might be a little bit biased, is through our Blue Star Families Military Family Lifestyle Survey, sort of getting an understanding of what military families are experiencing. But we also have a number of other programs that are available to help bridge that gap and support military families. And that's, we run a whole series of programming, particularly in the summer, with museums and parks and virtual summer camps. And we have in the fall, we have our Blue Star Welcome Week, which is a new annual event that we have in September. We know that an incredible number of military families, PCS, have moved from one duty station to another in the summers. So we take the opportunity in the early fall to welcome them to their new communities and start building those bonds so military families can plug into their communities right away. Next slide, please. So I wanted to briefly go over what are the top issues that we've seen for active duty military families and then for veteran families. These are the top issues that active duty military families, their spouses and service members, have listed as the issue of concern for them because of the military lifestyle. Maybe unsurprising if you guys are familiar with military life, is that spouse employment is a top issue for almost half of our active duty families. That is a perennial issue that we've seen time and time again since we started the survey in 2009. So spouse employment is a big issue for military families, perennial one, but it's been intensified by the impacts of COVID during 2020. Other issues that are perennial top issues are military families' time away from their family, time separated from, time that the service member is separated from their family. And then children's education. Particularly as military children move from installation to installation, they're moving schools frequently, and that can lead to difficulty in a continuous education and a stable educational experience for military kids. So all three of these top issues were issues that were intensified because of COVID during 2020, either because spouses had to step away from the workforce to supervise children's virtual education. Obviously, children's education has been disrupted in many ways. And then time away from family. Military families did not get a reprieve from deployment or from time away during COVID. In fact, it was intensified in that they might have had to leave earlier or stay away longer because of COVID and quarantine. Next slide, please. Next is the top issues. We asked the same question for veteran families as well. And what you might see as surprising is time away from family remains a top issue for military families or for veteran families. This may be because they continue to spend time away from their family, or because the time away that they spent during their active duty service has continuing long-standing repercussions for that family. So that may be why they're listing time away as one of their top concerns. For this particular audience, I want to highlight that PTSD, combat stress, and TBI is the third top stressor or top issue, and access to military or VA health care is right up there as well. So these are issues that I'm certain if you've worked with a veteran or military population, you are familiar with, and I wanted to note that for you. Next slide, please. So one of the issues that I wanted to highlight from our 2020 survey is the issue of potential discrimination. One of the things that we wanted to look at is the events of 2020 showed us that there are different narratives for military families of color and military families who are white, non-Hispanic. And we wanted to look into this into a little bit more detail because there's always been this discussion that military service is colorblind, that it's merit-based, so it doesn't matter what color or what life experience you have. So we wanted to dig into that and see if that was the perception of active duty service members themselves. So first we looked at perceptions of racial discrimination in the military. We asked about that narrative that racial discrimination exists against people of color in the military, and we found a perception gap there. Service members of color, often about half of our service members of color said that there is racial discrimination against people of color in the military, compared to only about 30% of our white, non-Hispanic active duty service members. Then we took that the next step and said, okay, so if there is racial discrimination in the military, is it better than, is it less prevalent in the military than it is in the civilian world? And about 38% of our service members of color said, yes, there's less discrimination in the military, but it still exists, compared to almost twice as many white non-Hispanic active duty service members who said there's less racial discrimination in the military. Then when we asked about experiences of discrimination, we saw again a disparity in that about 20% of our service members of color who had experienced racial discrimination in various contexts, whether that was in promotion or career advancement opportunities or in their unit or command or on the installation or base. So we took that information and noted it as, okay, so there's this issue. Now we want to know a little bit more about it so that we can address it or we can make recommendations to address it. So this week, actually, Blue Star Families is launching a custom-built survey addressing this issue to explore it and find out more about it. It is called the Military Families of Color Survey, so you'll see that launched this week so we can get more details about in what context does this happen, and to what degree does it happen, who does it happen to, and where does it happen, all of those questions. Okay, next slide, please. So I've selected a few of the findings that seem most particularly relevant to an audience that is looking at mental health. One of the things that I wanted to highlight here is one of the questions that we asked about in 2020 was military families' needs during a deployment, and what are their needs and whether they're able to access those needs that they say exist. One of the things that I thought important to highlight here is that both the spouses and the service members said they needed the same thing. They need to be able to communicate with their spouse. That is their number one need during a deployment. And that makes a lot of sense because communication is where you get your most important social support, communicating with your spouse. Other things that I wanted to note here is 58% of our active duty service member respondents said they needed access to mental health. And that was actually greater than our active duty spouse respondents. So we know that mental health is a critical priority for both spouses and service members when they're dealing with a deployment. Another thing that I think is important to note is when we ask them, what are these, we gave them a list of things and said, what of these things do you need during a deployment or an activation? Then when they selected those things, we said, okay, do you know how to access these things that you said that you need? So the top things, the good news is that most service members and spouses who said, I need access to mental health during a deployment, did know how to access that. So that is a good thing. Their top unmet needs are things like meeting social and recreational activities, especially those that have childcare options. That was a tremendous stressor for spouses in particular during COVID, is that there is little to no childcare support, particularly when childcare centers and schools are closed. Next slide, please. Another issue that I wanted to highlight here, and it's not an issue, it's more of an experience. When we're talking about military families' experiences, I wanted to address female service members and veterans, their experiences. Because throughout the whole military life cycle, female service members and female veterans have different experiences. And they're not all good and they're not all bad. It's a little bit of both. It's complex. So they may have experiences of gender-based discrimination. They may experience harassment or assault or challenges balancing their work life and their family life. But all together mixed in with those experiences are positive experiences of, purposeful work, camaraderie with their peers, feeling like a team. So all of those things are mixed in together. And it's not all good and it's not all bad. A couple things I wanted to highlight though are almost half of our female service member respondents said that they had experienced gender-based discrimination in their unit of command. That has mental health implications. That can have mental health implications. So that's important to note. Despite the experiences that they have had of gender-based discrimination, of harassment, and all of those things, the majority of female veterans still would recommend military service to a young person. So they're saying, all in all, I would recommend it. It was a good thing. There are some things that need to be addressed there. Next slide, please. Now, this is the one I really wanted to focus on with you, with this population, this group that we have here, because we wanted specifically to address mental health. One of the reasons that mental health is important to me as a researcher is I'm coming from a social work background, and I've worked in mental health before, so I know that it's an important issue for military families. I want to start on the left side of this slide that you see in front of you, and that is the respondents who are reporting a current diagnosis. It's important to me to convey that it's not just, are you experiencing symptoms of anxiety? Are you experiencing anxiety? Are you experiencing depression? It is, do you have a current diagnosis of these things? Given that question, about a quarter of our spouse respondents said that they have a current diagnosis of a generalized anxiety disorder. 16% of our service member respondents say the same. So that is a significant percentage. That is higher than I expected it to be. Similar with PTSD and major depressive disorder. There is a lot of focus on PTSD, and rightfully so, but it's not the highest disorder, it's not the most prevalent disorder in the group of respondents that we had. So it's important to consider generalized anxiety disorder and depressive disorder as well. The thing that I wanted, another important consideration that I wanted to note here is the prevalence of sleep disorders and difficulty getting sleep. I look at sleep as potentially a canary in a coal mine in that it may be indicative of other problems. There are a lot of mental health conditions that have disrupted or sleep problems as part of their criteria. So if you note down at the bottom left, 15% of our active duty service member respondents said they have a current diagnosis of a sleep disorder. In the top right, you'll see almost half of them say they don't get enough sleep to function effectively. Now we're digging into this a little bit more in our 2021 survey that just fielded. Ask, why are they not getting enough sleep to function effectively? Because we don't know if it's a matter of stress or mental health that is preventing sleep or causing disrupted sleep, or whether it is a lack of opportunity to sleep. Are they working so much that there's not enough time to sleep or get enough sleep to function? So those are two things that I thought were important to note. Another one is that almost a quarter of our family respondents said that they would like to receive mental health care but don't. And the reasons that they don't differ between the service member and the spouse. You might be unsurprised to note that the most common reasons for service members are wanting to keep their mental health needs and their work life separate, not having difficulty getting time off of work for treatment, having concerns about confidentiality and impacts on their career. For spouses, it seemed to be much more about logistics, not knowing where to get help, not knowing how to schedule an appointment, or logistically finding time to schedule an appointment and get childcare. So those I thought were important to note, as well as the increase in people who have used telehealth for mental health care. I had sort of had this impression going into COVID that COVID was going to make accessibility and mental health care accessibility better, because everybody could access telehealth from, you could be in your car, you could be in your bathroom while your kids are watching TV, whatever it is, you have access to it. But it's important to note it's not a panacea. It doesn't fix all the accessibility problems. Next slide, please. So that is a recap of just a few of the findings that we've had from our 2020 survey. Our 2021 Military Family Lifestyle Survey recently closed, and we are in the middle of data analysis for that. And our Military Families of Color survey is just opening up. So there's a lot more available, both in our comprehensive 2020 MFLS report, as well as other research that we have. All of it available on boostourfam.org. And I think I'm seeing some questions in the chat, but I will turn it back over to Angela.
Yes, thank you so much, Jessica, for sharing your presentation with us. And we have plenty of time to ask questions, and I see that we have one question in the chat. If you have any additional questions, please feel free to either raise your hand or type it in the chat. And then if we have some time, we'll even turn towards some discussion questions that I have around what are some of the needs that you're seeing with military families in your own state based on the work that you're doing. So if you want to give that some thought and chime in there, that would be wonderful. I'd love to hear from each of the participants in this call. We have folks from all over the place, from Ohio to Mississippi to Florida to Maryland, Tennessee, and beyond. And so really interested to hear some of the experiences that you're seeing with military families in your local states. So first question for you, Jessica, I see in the chat is, are the top reasons for not receiving care listed in order of greatest reason or listed in no particular order?
Yes, they are in order from the most commonly cited reason to the least commonly cited reason. So that is also available in the report. You can see those as well.
Thank you. Katie, do you have any other questions related to that, or do you want to start us off by sharing a little bit about what's happening in Missouri with military families? Katie, you may be on mute. I cannot hear you. She's typing. You're not sure how to take yourself off of mute. So on the right, on the top part of your screen, you should see a little speaker symbol, and you can unmute yourself there. Should be to the left of your phone symbol. All right, Amy, thanks for letting me know that you can't figure out the mic with the computer only. If you'd like to, you can go ahead and call in. There's a phone number I'll repaste down at the bottom of the chat for everyone. That will give you the easiest way to speak using your phone. Paste that here and put it in the chat. And then otherwise you can type up in the chat any responses that you'd like to share with the audience. Does anybody else have any questions for Jessica? I have one for you, just to get us started. How many respondents did you get for the 2020 survey in total?
So in total, there were 10,926 people who responded to the survey. That includes both active duty families, veteran families, National Guard, and Reserve, as well as people who maybe didn't finish the survey, but they got to a certain point in it. So there were quite a few, but once you divide it up into their respective groups, it gets a little bit smaller.
Okay, great. That's a pretty strong response, though, 10,000. Great.
Yeah, I was really excited. I was very excited to get that many respondents, and to better yet, to have respondents in different subgroups so that we could do analysis that way. For example, we had quite a number of caregivers. One of the questions that we asked about is whether you are an unpaid caregiver, and we had somewhere around 3,000 respondents who are unpaid caregivers in that. So what we've done is create a special report deep diving into our caregiver population, and that is coming out on Wednesday, so that'll be published shortly as well.
Oh, I'll be really interested to see that. That's exciting.
Yeah, it was I'm excited to share it because it's I think a little bit of a new take on caregivers.
Great. So Tanya Gardner's asking, did the survey talk about the effects of burnout or job dissatisfaction?
So I love that question because you led me right into asking that in 2020. We asked that in the 2021 survey that just closed. This is the thing that I like the most about having an annual survey is we'll open the door in one survey and find out a little bit about it, and then we can go back and ask kind of like a follow-up question in the following year's survey. So we've known for a while that employment for military spouses is important, but when we wanted to focus on like, it's not just about getting a job versus not getting a job. Like when I last PCS, I moved away from a assistant professor position at a university to a SAT, ACT tutor. I was employed, but I was not employed at the same level that I was in my previous career. So we wanted to focus more on not just the dichotomous variable of being employed versus not, but also about your satisfaction with employment, and conversely the dissatisfaction, not just for military spouses, but also for service members, also for National Guard and Reserve service members who have civilian employment. Both of those were important as well. So that should be forthcoming in our 2021 survey results that will be out in early 2022.
Great. We'll be looking for that. I see a couple of folks are typing in the chat, so while we wait for those questions or comments to appear, I wanted to just check in to see if anyone wanted to share a little bit about the needs of military families that you're seeing in your state. Okay. So Katie, I'm so sorry you're having trouble with the microphone. I know that that can be frustrating, but I appreciate you communicating in the chat, and I'm happy to help facilitate as much as we can. Perhaps Emily can help you in the background. So Katie, you're saying, I am a military spouse and work in suicide prevention. The survey was family members who said they had a hard time making an appointment. Can you tell me more about the context for the difficulties? Was it finding a provider who accepted the health insurance?
Sorry, momentarily, I had difficulty coming off mute too. I'm glad I've got that figured out. I'm so glad that you are, both a military spouse and work in suicide prevention. I did that for a few years when I first got to this duty station, and it is really valuable, rewarding, tough work. So I'm glad that you are in there. In terms of family members who said they had a hard time making an appointment, that was the response option. The answer option is I had difficulty making an appointment. So I don't know in detail whether that was I couldn't find an appointment at the time of day that was right. I couldn't find an appointment for which I had childcare. There was no one in my local area that was accepting my insurance. There was no one in my local area that had an availability anytime soon. So I wish I had more details about that, but I don't have that at the moment. I will note that this is something we continue to look at every year. Mental health is a really important issue. In fact, in the 2021, we took a deeper focus into children's mental health and whether children were able to get the mental health care that they needed. So I wish I could give you more details about that, but I just don't have them.
Thanks, Jessica. Then we also have a question from Angela Prater. Are there any resources, information you can provide for those struggling with worry that participation in mental health services will impact their career? And then the second part is, where can we access a copy of this report for future reference so I can share some of the information with my team?
Well, the second question is a lot easier to answer than the first, so I'm going to start there. You can definitely access a copy of this report at bluestarfam.org, and you can go to /survey. That will take you right to this survey information. But if you also want to look at some of our other research, and there's a lot coming out, you would go to the main page and then look at national research as well as community-based research. So that's where you want to start. In terms of resources and information for those struggling with worry that participation in mental health services will impact their career. That's sort of been the tough nut to crack that we've had for a long time, right? There's a stigma against mental health access, and I feel like it is getting better. People are more willing to access mental health care. They're more willing to talk about accessing mental health care, but there is still a stigma, and B, still a challenge for those who, especially those who have like a top secret clearance or a security clearance that they're concerned about, that if they access mental health care, then they will be passed over or experience some negative mental health, negative career consequences. The thing that I thought was really important that we've noticed over the past few years is it's not just the service member who is concerned about their career. It is also the spouse who often is not accessing mental health care because they're concerned about the impact on their service member's military career. That if your service member is deployed and you're experiencing challenges, you may not access mental health care because you're concerned that it's going to reflect badly on your service member. And then there's also the concern, I don't know if many of you are familiar with the Exceptional Family Member Program, but if you have a mental health diagnosis, particularly mental health diagnosis like anxiety or depression, you are supposed to be registered for this Exceptional Family Member Program. And that the intent of this program is to make sure that when a family relocates with PCSs, there are the services available for the special needs that that family may have. So its intent is good. It often does good things. But there is a stigma that if you register, that if you are enrolled in this program, that your service member will no longer be eligible for different duty stations, like duty stations Oconus in Japan or in Europe or in Alaska or one of the other Oconus places. So there is the fear that people will not access mental health care because they will not be able to get to desired duty stations. That's a long answer to a short question. Did that answer your question, Angela? Kind of?
Yeah, thanks, Jessica. This is, yeah. And I think Katie kind of asked a similar question, and you touched on that, so that, you know, spouses hesitate to seek help out of concerns that it would impact their spouse's military employment eligibility to deploy. So yes, you touched on that. Thank you. And I think this is a really good conversation to have. Does anybody else have any experiences that they'd like to share around this question of being able to, you know, being able to access mental health care or having that concern? What have you seen happening in your own experiences?
I know you didn't address me specifically, but there was one piece that I wanted to add that I have seen anecdotally in coworkers who are not coworkers, other people I know who are clinicians, is that the spouse becomes the entree for the service member to access service or access mental health care. So the spouse will go and seek counseling for marital concerns, and that is how the service member can get access to mental health care without it showing up on their record. So it's a workaround, but it becomes an issue. Oh yeah, and the firearm, sorry, I'm reading the chat and I see that Angela said a concern for accessing mental health care is the fear of losing their ability to own firearms. And I know that that is a huge issue, particularly around suicide prevention.
Thanks, Chaka McDonald, for your comment saying you're seeing that veterans are so frustrated attempting to get plugged into the VA. I know that that can be a challenge. Thank you for sharing that. So,
to answer Savannah's question, Savannah wrote, for clarification, is there is truth to a spouse, I think is there truth to a spouse seeking out mental health services and it impacting the service member? Informally, there may be. Formally, there is not supposed to be an impact. However, through the mechanism of the EFMP program that I mentioned, if your spouse seeks mental health care and has a current mental health diagnosis and is signed up for this, is enrolled in the EFMP program, that can prevent the service member from accessing certain duty stations or being sent to certain duty stations. Now, the EFMP program does vary in different branches. So some branches do a better job than other branches do. And they're in the middle of sort of like reviewing and revamping this. There was just a GAO report ordered on EFMP. So that's a whole thing that I don't have enough expertise or time to get into at the moment. But there is some truth to it.
Thanks. Yeah, thank you, Lauren. Can affect them being sent to those duty stations while accompanied by the family members who have particular health care needs. Thank you. All right. Well, I would like to go ahead and move us forward in the agenda. We have a lot to cover, and I just want to thank you so much, Jessica, for sharing your time and expertise with us. And this military family lifestyle survey is such a great tool for us to be able to really get at the needs and understand how we can help our service members and their families and veterans and their families. So I really appreciate you taking the time, especially on such a day as this, as moving day. So thank you again.
Yeah, thank you so much. And I do want to reiterate that if you guys have any other questions or things that I can provide more clarification on, either on the survey or otherwise, please reach out, let me know. I might be unavailable for the next couple of weeks, but after that, I promise I will get back to you.
Great, thank you so much. And thanks, Katie, for your comment in the chat, sharing that U.S. citizens only lose their gun rights due to mental illness when a judge declares them ineligible or determined to be a risk to themselves or others. You have to be adjudicated by a court and have due process. Accessing mental health services in and of itself does not take away gun ownership rights. So thank you for sharing that in a clarifying statement there, Katie. It is my pleasure to introduce you our next presenter, Dr. Larissa Owen. She comes to us from Children and Family Futures. She's a Veteran Children and Families Program Director there since 2004. She works on several programs, including leading the Veterans and Military Families projects. She has extensive experience evaluating the effectiveness of program implementation, program enhancement, and evaluation methods for state and national programs, including training and evaluation of collaborative programs. She's been a lead evaluator on multi-year projects and evaluation staff involved with collaborative courts, veteran treatment courts, interagency services, and the effectiveness of various models of peer support and data sharing for assessing children and family impact. She's a national speaker on issues related to child welfare,
Angela, I think we lost you for a second. Can you hear me?
Can you hear me?
Yes, I can hear you.
You can? Okay.
Yes, I can hear you now. Yep, you cut out for just a minute.
Okay, that's not good. I'm so sorry. I was giving my introduction to Larissa. The last thing I wanted to share with you all is that she is an author of a children's book about children of veterans, so that's really cool, and she comes to us with lots of great experience. So I'm going to go ahead and turn it over to her, and I hopefully will have my audio issue fixed. Larissa, the floor is yours, and you have control of the slides as well.
Thank you very much. Let me make sure I know how to do this. Go back and forward. Perfect. Perfect. Well, thank you. My work at Children and Family Futures is more focused on the children and family of veterans. We provide technical assistance and training to help community-based agencies really improve their identification and engagement of veteran and military families. And as a researcher and in providing technical assistance, I've been amazed at how many misconceptions there are about children and family of veterans. So sometimes probably not needed with this group because of the 89% of you that are connected to the military. But sometimes it's important to explain the difference between when you are a family active duty and then when you become a veteran and the family does not have the same access to services and supports that they once did. And especially for community-based agencies, we need to be mindful, even though so many of you are knowledgeable, that we're dealing with other agencies and people that may have those misconceptions. And so what we need to remember, obviously for us, we know that the needs of the family doesn't stop once the service member becomes a veteran, and the needs of those families don't stop. So we need to make sure that we don't take for granted that we understand the distinction, but that we make sure that others, especially community-based providers, understand the distinction. So the way we look at this is we have a framework of the 3 N's. We have the numbers and the needs and the network. And we may not know that it is a very large percent of these veterans that don't gain access to mental health services because they go unidentified. So the first we look at is numbers. We should all know the numbers in our state, in our county, in our communities of the veterans that are in our community and of the children and family of veterans. And all that data is on the VA website, and we can get that number and make sure that we have that when we're talking about the numbers and needs in our community. Once we have that, and we know that the research says that about 40% are affected by substance use, domestic violence, trauma, We know that we need to be looking for and serving that 40%, whether it's in the VA, community-based agencies, social services, family resource centers. We need to be reaching that 40%, and we need to make sure that they have access. So we often say we cannot make an impact on what we do not count. And this is important. We need to make sure that we count how many veterans and children are in our county and state and ask the questions about family status. Now, what I found often is that usually the question is, are you a veteran, yes or no? Now, if you ask someone like me, who is a spouse of a veteran, I am going to answer no. So you are not going to be able to collect information. In California, we collect information on children who are active duty, but we do not collect information on children of veterans. So the better way to ask the question is, have you or a member of your family ever served in the military, regardless of discharge? And that's critical so that we can gain access maybe to grandparents who are taking care of children of veterans or even children of active duty families, and so that we don't miss those other family members. I think Jessica did a great job explaining that sometimes the spouse is the access point to getting a veteran into mental health services, so we must identify them properly. One of the best model programs was the Ask the Question campaign that SAMHSA did in New Hampshire and has been replicated in North Carolina and in Orange County, California, and many other places. But it's a way to make sure that we guarantee that access by, of course, identifying. So then we go to the needs. And we want to make sure that we are clear about making sure that we provide services that support the families, the veterans, and the parent-child relationship. And these are some of the questions that we can ask about services and support, assessing for trauma, what are the appropriate interventions, how are the strengths identified and leveraged? And even for military sexual trauma, its effect on family is a need that we really need to make sure that we're identifying in the caseloads through the numbers and in the engagement that we're working with the family. So again, the need, 1 out of 10 at minimum have a problem with alcohol or drugs, and we know that these are family diseases. So we really need to make sure that, of course, we have early intervention and identification and screening, and we make sure that we're bringing our community-based agencies as partners. Even though we have that connection, and maybe we're at the VA or we're working in a suicide prevention, we need to make sure that non-military family-focused agencies are aware of the work that you're doing, understand how to connect with military families and veteran families. What are the questions to ask? How do you appropriately ask? And that brings us to the network. Oops, one more. I think Jessica hit on a couple of these, that we really need to make sure that we focus on the fact that these children that are affected by their parent service have poor academic functioning, depression, anxiety, suicidal ideation, and obviously we need to make sure that that is identified as a need, and then we bring in the network. So we're going to build a network of services, and how do we do that? And again, we can talk about making sure that there are family service agencies connected to our existing services. We can also provide training to community-based agencies. And the way we've seen that done very successfully is by explaining more about military culture. How do you ask? What are the ways that you should speak to veterans or speak to family members? What are maybe some of the acronyms, Ptsd, OCONUS, all these words that maybe the community doesn't know, but you can bring them in and start training and talking about ways that you can share families and ways that they can learn how to provide services and interventions for these families. This is critical, what looks like to be a little bit cut off, but it's my secret sauce, I say, for the most effective way to engage is, of course, peer support. Peer support and peer mentors are those people that are either military connected themselves or have a family member that were in the military and really can connect with the veterans. We've seen the success of that in Veterans Treatment Court. We've seen the success of what the VA has done with peer mentors. And it's a really amazing way to make sure that family supports are also given a peer support model so that they can bring that camaraderie. And there are evidence-based screening tools that a non-clinician can give to military and veteran families. These peers are in the community. They have very good connections with veteran and non-veteran agencies, and so they know how to help the family navigate through the system. So this is all good, but we have a lot on our plate and lots of meetings, and they're all virtual, and no one gives us a potty break between our meetings. So where are we supposed to find the time and the money to do this? And we are certainly not asking the VA to do this. But what we are doing is saying that there is federal and state existing money out there to make this happen, whether it's peer support or family support models. This could be a whole webinar in and of itself, but and I will leave my email address in case you all want a little further knowledge about ways in which you can get this model funded. But it's definitely not asking the VA to add one more thing on their plate. Community mapping, there's many types of community mapping that can be done to bring about family services and understand more about non-veteran agencies that want to be at the table and want to help serve veteran and military families properly. So if we improve identification and engagement and retention, then we're pretty much guaranteed to improve longer-term outcomes, because we know that when we deal with the family as a whole with substance use and domestic violence and mental health, we know that we see greater improvement in longer-term outcomes. And we think that that's the most critical. So my call to action for you all is, what can we do this week to take any of the numbers, needs, and networks and implement them and carry them out so that we can better serve veterans and their families?
Thank you so much, Larissa. Thank you for sharing your contact information there as well. Again, we have time for some questions and time for some discussion here. So if you would like to either use the raise your hand feature, I can call on you and you can unmute yourself, or you can type in the chat any questions that you have. I know a lot of folks on the line who are part of the Governor's Challenge and Mayor's Challenge are working on activities around asking the question, have you or a loved one ever served in the military? I'd like to start off by just asking you, Larissa, can you share a little bit about how that particular activity has worked there in Orange County? I know that you've been working on an initiative there and getting that implemented.
Yeah, we were really amazed at the work that the New Hampshire model did. And although that was focused mainly on active duty, we went ahead and made the focus veterans. And so we sort of adapted the question because we do find that sometimes we have to add the regardless of discharge. Because sometimes people feel uncomfortable with other than honorable or medical answering the question. And so we also added a second question, do you have children? And so far we surveyed sort of a needs assessment. We surveyed about 300 agencies, non-veteran agencies in the county. And almost 90% said, please come and tell us how we can properly screen, assess, identify, and serve this population. So we were really excited, and there's a collaborative out there that has been doing some trainings for those non-veteran agencies and social service agencies. So it's been a big success.
Great. So you actually added another question, do you have any children, in a follow-up to the question of whether or not you or a loved one have ever served?
Absolutely. Have you or a member of your family ever served the military, regardless of discharge, and do you have children?
Okay, gotcha. And so you're doing training now with some of the agencies there in Orange County?
Yes, whether it's the faith-based communities or hospitals or family resource centers or children's mental health agencies, we really took the model of New Hampshire and segregated each group from law enforcement to courts to try and make sure that we were speaking to them in the manner in which they understood. And again, the New Hampshire model really guided us in that way.
What does the training look like? What kind of training do you do?
So again, it's adapted based on the provider, but for law enforcement, we talk a little bit about what are the ways that you can ask them questions, maybe when you're working with a veteran. What are the ways that you can, in booking, ask using a lot of the intercept model information. With faith-based, we say what are some of the ways we can engage families into maybe groups within churches and synagogues. So we've really tried to adapt it based on looking at different trainings depending on where their main focus was.
Great. Thank you so much for sharing that. Just wanted to throw it back out there to all of our participants. Does anybody have any questions for Larissa?
You know, I might ask, for my own selfish knowledge, is are you already collecting data on this population? Is this something that is already a part of what you're working on? I know it may be obvious for us to say that we're collecting information on the veterans. We know our veteran population. But how about drilling down to family members and children?
Great. If you want to answer in the chat, you can do that and share how you might be collecting information on military families. That would be wonderful. Or if you'd like to unmute yourself, you can go ahead and do that now. Okay. Well, that's okay. I just want to, again, thank you, Larissa, for sharing your presentation, and I'm really, really intrigued by the idea of being able to drill down and figure out who the family members are and how we can serve them, and figuring out a way to incorporate that into our activities going forward, I think is going to be so critical to be able to serve the needs of our veteran families in particular. I think there's such an unmet need there. Angela Prater, thank you for sharing in the chat. As of right now, our agency asked the question during intake, have you or a dependent family member served in the United States military? Thank you for sharing that. And then Amanda, you shared in the chat, in every assessment we do when starting a client to services, we ask, have you or an immediate family member served in the military? So that's very helpful. I guess that just requires some follow-up to figure out whether or not that family has children. Do either of you have any protocols in place about following up on the question once that's checked off in the intake? Angela or Amanda? I see, Angela, you're typing. If yes, then it breaks down more questioning of what branch, time served, etc. Oh, that's great. So you're able to continue to collect more detailed information and get that from the veteran. That's awesome.
That's great. That's really great. And that's good to hear. And I like the way that is asked. I think that's very helpful. I think we also need to make sure that we're bringing other providers to the table, because you both have made it so clear in your questions and drilled down so much farther. We do need to educate people who are not at the table about why that's so critical. And I wonder if there's anybody that can maybe talk about what success you've had bringing non-veteran, non-military agencies to the table to help them understand why it's so critical for them to be identifying properly.
Thank you for asking that, Larissa. I think that's a really great question. How have you been able to highlight this issue with your partners at the table, particularly on the team? Does anybody want to share any discussions that you've had with partners on how we can support military families through your efforts on the governor's or mayor's challenges? I see Angela and Amanda are with the same agency. Thanks for sharing that. Taka is typing in the chat, and I'll wait for a second there, but if anybody else wants to chime in, please go ahead, and I will move us forward in the agenda in just a moment. See some more activity in the chat, just waiting for it to pop up, and I really appreciate everybody chiming in, and I know it's have to sit with a little bit of silence, but I do appreciate you sharing your experiences and typing in the chat, and I hope that you find this discussion to be useful, and I think that military families are so important to the work that we're doing. especially around suicide prevention efforts. Chaka, you have shared, we have shared with our provider network how to ascertain veteran status. This has helped them assist more veterans that utilize their services. That's great. That's wonderful. Thank you so much for doing that. Great. Well, again, Larissa, thank you so much for being with us today and sharing your knowledge. And I appreciate the framework of the 3 N's. That makes it so easy to remember. And yeah, if you want to put your information in the chat, we can always field more questions over to you if they pop up. I know sometimes when we're on the spot, we can't think of it. And then once we hang up, we're like, oh, I should have asked that. You can always do that by reaching out to me, and I can connect you for sure. All right, so I'm going to give everyone a little bit of homework to do. So what I'd like for you to do in follow-up to this session is take a look at the Military Family Lifestyle Survey Report. It's at bluestarfam.org/survey. The link is right there, and I think we had put that in the chat as well. Take a look at that. There's so much information there to share. We were only able to give you just a little snippet of it today. So take a look there, and we'll talk a bit about what you found to be most interesting to you, and any surprises that you had in our next session. We'll just have a chance to share out. I also want you to consider the following questions as you leave this session. Are child and family serving agencies on your governor's or mayor's challenge team? So take a look at your team and its composition. Make sure that you have that family voice at the table. Then are families and children being addressed in your strategic plans? Take a look at what you have down in each of your strategies. Are there opportunities in your planned activities to incorporate the family component and strengthen supports for families? Really just making sure that that family voice is heard and that their needs are being addressed through your efforts. And so I'd love for you to share how you might be able to incorporate children and family strategies into your plans as we go forward. And we'll talk a bit about that in our next session, which is coming up on July 26th. July 26th from 2 to 3:30 p.m. We're going to be talking about the impact of trauma on the family. And we have Sean Moore with Caregivers on the Home Front to give us a caregiver's perspective. And we also have Dr. Greg Luskin with the National Child Center for Traumatic Stress and, the National Center for Child Traumatic Stress. And he's going to be talking about how we can support military-connected children and youth and the impact of trauma on the family. So looking forward to seeing each of you there on the 26th, and I hope that you all have a wonderful day. I'm going to go ahead and give you an extra 15 minutes back of your time this afternoon. I know time is precious these days, and it's tough to be online for so long. So take care, and I will see you next time. Thank you so much.